Now, during this presentation, or excuse me, session, participants are going to learn from a panel of community members who will share their experiences on various reproductive health topics. The panel will discuss topics such as family planning, disclosures, self-advocacy, and more. Now, this time, I would like to introduce our very own Manager of Education, Natalia Winbury. And Natalia will briefly introduce our tremendous, and I'm gonna say this one more time, tremendous panelists who I would like to thank for being here today. Natalia, I also want to thank you for being here with us and all your efforts to make this session possible. And with that, welcome everyone again. And it is my pleasure to pass it to you, Natalia.
Thank you so much, Nicole. I am so excited to be here. I'm so excited to be here with all of you and to start us off and welcome you all again to our first session of the day. We do have 3 speakers today. So we're going to be hearing from Connor J. Graham, Esmeralda Vasquez, and in just a couple moments, we should be getting James Cosman into our room. He might be joining us a little bit later. But really in a moment, we're going to hear from each of our speakers as they introduce themselves and share their stories. And so with that, to start us off today, I would love to welcome Esmeralda. And if you could share a little bit more about yourself as a member of this ultra rare community.
Hi, everyone. I'm so excited to be a part of this panel and just being in a casual environment where I can share a little bit about myself and my story. I'm born and raised and currently live in Chicago. I was diagnosed with glandular thrombasthenia, which is an ultra rare bleeding disorder at the age of 1. I spent a lot of my childhood in hospitals, and then everything kind of stopped in 6th grade. So all the hospitalizations, all the nosebleeds, all of that ended. And then I transitioned to puberty, and that kind of set a whole new era of challenges. Once I overcame that, then adulthood kind of settled in, and right now I'm pretty happily married, happy. I don't have children, and I'll kind of talk about that in a little bit. I have a very active lifestyle. I bruise easily, but it doesn't stop me, obviously, from canyoneering and hiking and biking. So I just love being as physically active as I can. The doctors always say, you can do anything you want, except I think skydiving and scuba diving, which I can live with that. I have a really strong social support network, a very loving family who has kind of encouraged me and stood by my side throughout the years. And more recently, I started getting involved with the National Hemophilia Foundation, just kind of being a voice for my community. Professionally, I am an occupational therapist and I work with children with special needs. And it's kind of nice to shift gears a little bit and join this community and not having to be in a work professional environment. So I'm really happy to be here. I know I didn't have opportunities like this when I was younger, and I always wish I had somebody to talk to who maybe shared some of my same experiences. I know we all have this common denominator, our bleeding disorder, but I think it's just kind of nice to see that there's other people out there like you, and that's always just a very nice feeling to have. So I'm very happy to be part of this panel and being with Connor and James and everybody else. Thank you.
Wonderful. Thank you so much, Esmeralda, and really highlighting that theme of community. And that's really why we're all here today, to be in community with one another as part of this wonderful ultra rare community. So next, we're going to be switching to one of our next panelists, Connor. If you could please share a little bit about yourself and your story and your experiences.
Hello, everyone. My name is Connor Graham. I am 24 years old and I am a graduate student. So my journey began about 10 years ago. My brother and my mother were diagnosed with factor 7 deficiency. And at the time, I was just considered a carrier, but I was going through puberty at this time, and we'll talk a little bit more about that later. But I had painful periods. I was bleeding a lot, right, more than normal. And so this really kind of started my journey into the bleeding disorders community, right, along with my brother and my mother. My mother at the time was around her mid-40s, right? She went her whole life almost without knowing she had a bleeding disorder. So this was really big for our entire family. And just like Esmeralda said, we we're kind of thrown into this amazing community, right? And it's been great, right? Not just in South Carolina, where we're from, but also other states as well. So about 3 years ago, actually, we went to a hemophilia conference, and my father did some genetic testing, and he got diagnosed with factor V Leiden. So if you're not familiar with that one, it's actually excessive clotting, right? It's the opposite of factor VII. And then at that same meeting, I also got diagnosed with factor V Leiden. So I am a carrier for factor VII deficiency, and I also have factor V Leiden. So this has really been a learning experience for my family and I, just learning more about our disorder, but how to be self-aware and how to self-educate. And I'm so happy to be here. Thank you.
Wonderful. Thanks so much, Connor, for sharing. And you brought up a lot of things that I think we're going to be touching on maybe a little bit later, but then also throughout our event today. So puberty is going to be a little bit later in session 2. Session 2 and 3, we are happy to have a genetic counselor who will be joining us. So we're really going to have some of those themes, I think, woven out throughout our day today. But thank you again so much for sharing. And then we do have, I think, our final panelist, James, who is joining us mid-swim. He's a swimmer, so maybe he can tell us a little bit about that. But we're happy to have you here, James, and welcome. And if you could tell us a little bit about yourself and your experiences.
Hello, my name is James Cosman. I'm 17 years old. Please forgive the little bit of background noise. We're at a swim meet. And I was actually diagnosed, well, sort of diagnosed when I was 4. When I was 4, we got told that I had a bleeding disorder. And that was it. So I'm sure the first thing that pops into most people's mind is hemophilia. And that's what the doctors thought. They did blood testing, and I'm good for fact. I have a completely normal factor 8 and 9. Well, then they're like, well, that's weird. Maybe it's von Willebrand's. So they tried for that. I didn't have von Willebrand's either. And then they were starting to get a little concerned because, you know, that's the big ones. Well, so they tried factor 7 and factor 5 deficiency, and everything was fine. So according to paper, I am a perfect human being. Yeah, I have joint bleeds, like your severe hemophilia A, as well as the mucosal bleedings, which really makes the dentist a fun time. But so with all that, they didn't know what to do because I didn't have a bleeding disorder from paper. So they put me on stymate for a while. Well, suddenly it stopped working. And they were like, what's going on? They gave me a stymate challenge, and my von Willebrand's went up to the 500 range, which is dangerous for clotting. So that was immediately stopped. Then their only option at that point was platelets. Well, platelets is a very long and grueling process because it's usually a 3-day process. You go into the ER, they admit you, you get the platelets the next day, and then you get released on day 3. So with that, they thought that it was best if I didn't play sports. They tried to say no sports at all. And that was, our family felt that was tough because you need to stay active. Otherwise, you'll end up with joint issues because you haven't used them. So I started swimming. And that's kind of where it went from there, is the doctors slowly took away everything. Obviously, football, lacrosse, hockey, those were taken out first. And then basketball and baseball, until eventually it was just swimming that was left. And they tried to take away swimming a few times, but then what do you have? So one thing that I've noticed is sometimes the doctors do know a lot about this specific field. Hematologists know great things about hematology, but they don't know the whole thing. They get so focused with a single piece of your body, they ignore the rest. So we had to fight to allow me to stay swimming, which was a good thing because now I'm looking at possibly going to college on a swim scholarship. And it's amazing because once you have a doctor that listens to you, you can get the right treatment. So I currently am on a factor prophylaxis prophylaxis every other day, so it's a little bit more often than most people. But with that, I'm able to swim and able to live a pretty much normal life.
Thanks, James. Thanks so much for sharing and your really incredible journey that you have taken. Thank you for kind of taking us through that as well. And we'll definitely touch, I think, a little bit later on this idea of self-advocacy with providers and kind of what that means. And so some of the things I think that you were talking about are things that we're going to touch on a little bit later in our session. But thank you all for introducing yourselves and kind of giving us a little bit of a taste of your experiences and your journey thus far. We're going to switch gears a little bit and get a little bit deeper into our topic of reproductive health. And we wanted to talk with you all a little bit about family planning. So Connor, I'm going to go ahead and start with you and ask you, what are some things that you've had to consider when deciding if and when to start a family?
Right, yes. So like I mentioned, I am 24 years old. And even though it doesn't seem like I'm ready to start a family, it's totally possible. So I have an amazing mother. Her name is Connie Montgomery. And we talk about this often, right? So not only do I carry the factor 7 deficiency mutation, but also factor 5 Leiden. So I just really have to take into consideration both of these, right? And I think my future partner and I will definitely have to sit down and see what's best for us, right? I've thought about adoption as well. So right now, I'm still on the fence, but maybe in the future, it might change.
Thanks, Connor. And then I'm going to go ahead and move it on over to James as well. Similar kind of question. What have you been thinking about when you're considering the future? You are a young adult, but you're considering the future and potentially having a family. What are some thoughts that have been going through your mind, James?
One of the things that I have to be aware of is my bleeding disorder is not recognized. So if I do pass it on, which you figure if it runs like hemophilia, that's about a 50% chance, they won't know what it is and we'll have to go through the same process. And that's tough because I don't want to wish my journey on anyone else. Don't get me wrong, it's good that I've made it this far, but hasn't been easy. So I have to be aware that if I do have a child at some point that's biological, I could be giving that to them. And it makes it tough because you almost feel guilty, even though there's nothing you could have done. So that's one thing that's very heavy on my mind anytime I think about futures, like, am I going to be able to actually have a family? Now, obviously there's adoption and there's other options, but it's just hard to think that I could potentially be having my child go back and get lots of platelets infusions and going on something like Stymate just so it doesn't work.
Yeah, thank you. Thank you for sharing. I know that this is not maybe an easy thing to sort of think about, especially when you think about maybe some of the risks and yourself not having a recognized bleeding disorder. I did want to stop for just a moment and do mention, if anybody who's joining us today, if you have questions for our panelists, we will have a Q&A sort of towards the end of our session. So please do not hesitate to put some of those questions into our chat space, and we'll be sure to get to those a little bit later. So turning to you, Esmeralda, same kind of question. What are some things that you've had to consider? And I know you, in your intro, you kind of referenced this as well, but can you talk us through what was some of that thinking about why you may not have decided to then start a family?
So I'm a little older than James and Connor. I'm actually 42 now. So I know has been a lot of changes in medicine and the way bleeding disorders are treated. But I remember as a kid, doctors telling my mom asking doctors, is she going to be able to have children? And I'm 7 at this point, so I'm just playing with dolls or whatever I'm doing. But I'm listening. Children listen to the conversations that adults have. So I remember the doctors telling my mom, like, no, it's too risky. She can get pregnant, but the delivery is just a bloody mess. So she will we will not recommend pregnancy and delivery. So I kind of lived with those thoughts throughout my life and then into my early 20s. And in your early 20s, you're dating, but you're not really thinking so much about family planning, and those conversations don't occur when you're like 21, when you're just trying to go to a bar and just live like a normal 21-year-old life. But it's the thought came stronger when I started nearing my mid to late 20s. And at that point, I guess I realized like, I'm not going to be able to have children. So I started doing other things like traveling a lot, focusing on my career, like kind of developing other ways that kind of made me happy. So I did see a high-risk specialist, and he, gave me some pretty heartbreaking news. He told me like, I've been a doctor for 30 years and you're going to be the 5th woman that I'm going to say absolutely no pregnancy. Well, then I went back to an HTC center, hemophilia treatment center, and the doctor was like, absolutely, you can have a child and deliver. He's like, it's been done before with women with Glanzmann's thrombasthenia. It's a high risk pregnancy and delivery, but it can be done. It has to be planned. So you have to have a team of professionals kind of ready, like a anesthesiologist, just a whole team. And he also said there will have to be like genetic testing for my partner. So I think at that point, as I near my 30s and I met my now husband and we had that conversation, we just kind of decided to just not go that route. We're like, it's just going to be us. And maybe if we want, we can always adopt. That was always an option. And he was open to that. I mean, he's such a wonderful man. He was open to doing that. So we kind of had this conversation. So we decided to just not try to get pregnant. In my eyes, it was just too risky. I know there's definitely women with Glanzmann's who went through it just fine. Or now there's like in vitro and surrogate mother. So there's lots of other options now. So everybody should kind of consider their options. I know things are changing constantly and new advancements in therapy and treatment. So that's always very promising.
Yeah, and if you can tell me a little bit about, it seems like you had you spoke to one professional and they're like, no, it's not at all possible. But then you went to an HTC and they were like, well, maybe. Can you tell me a little bit more about that?
So, that was a rough period. When I went to that high risk clinic, it's a very renowned clinic. And when I had that conversation with that specialist who was extremely experienced, the odds he gave me were just, you're the 5th woman in all my career. And I went back to the HTC center. And those are the people that I trust the most. Those are the people that know my bleeding disorder. Those are the people that have worked with women with my condition. The high risk specialist, he's never met anybody with Glanzmann's. He's like, honestly, I've never even heard of it. So he had to do some research. He's like, based on what I'm reading, it's a bloody mess. He's like, and it's not the pregnancy or so much the deliveries after the delivery when your body kind of expels a placenta and it detaches. It's like that. There's a lot of capillaries and a lot of blood, and that's where you can risk potentially bleeding out. So when I went back with that information to the hematologist, he's like, it can be done. There's lots of ways to control bleeding nowadays. And I trusted him. I trust him. And I think he wouldn't have given me that advice. He was the one who told me, you can't go skydiving or scuba diving. So I knew that he was familiar, but it was just a decision that I didn't feel comfortable making and going through with a pregnancy. It was a personal choice.
Mm-hmm. Of course. Well, thank you so much for sharing that. I know that could be a little bit difficult to then talk through, but I think it's for the rest of our community here, we really thank you for being open to really talking through some of these things. So I'm going to kind of shift us a little bit. So, we were talking a little bit about family planning and some of the thinking and decisions that really have to go through that. But taking a step back, kind of first you have to have a relationship, right? And so I'm going to ask a couple of questions about what it's like to be in a relationship with someone else. And then how do you handle disclosures? So James, I know we're kind of in a tight timeline with a swim meet. So I wanted to start with you and really talk through, if you're in a relationship with somebody, how do you share this information? How do you talk about some of these things with another person?
Honestly, how I usually end up sharing it is through a swim meet. So if you guys do anything active, you know that you're gonna have to take your treatment more. And in my case, it's an IV infusion. So with me swimming, I'll have to infuse on the pool deck. So you get questions from the lifeguards and from the officials and from other people like, hey, you just stuck a needle into yourself. Why? Because, unless you're in our little world, people don't understand that. So that's how I usually end up disclosing it. Is I'm like, I have a bleeding disorder, and this helps me clot so I can swim normally. But outside of that, you have to really be careful, because I've had quite a few people who you tell them that, and then they're like, oh, they treat you almost like a glass vase. Like, oh, you're too fragile. I don't want to even touch you by accident. But on the other end of the spectrum, if you don't tell them, they're going to treat you exactly the same, which for a sports team isn't necessarily the greatest. In your relationship, you're going to have to tell them eventually, right? If you're going to you're going to marry them or even go on more than one date, you're going to eventually have to tell them, because they're going to know. And if they find out through something horrible, it's not only going to break their trust, but it's also going to break their heart if something happens. Because if you're in a car crash and then they're like, oh, they bled out because of their hemophilia, at first their trust is broken, and now they feel horrible overall. So I think it's better to try and get it out of the way early, because if you tell them and they say, nope, I can't date you, well, good, right? It's as horrible as it sounds, it's good, because they're going to have to live with you for that. So if you tell them early and they're like, no, then you know not to get your hopes too high.
Thank you. Thank you so much for sharing about that. I think it's really interesting about, again, being so open about things and kind of from the get-go, being this is who I am and this is a part of me. Connor, we're going to move over to you for a second. Same kind of question, how do you have these conversations when you're in a relationship with another person? How do you voice this information?
Right, yeah. So I'm a little bit like the opposite of James. I'm more of a private person. So it really has to be a tight friendship or a very serious relationship before I disclose any really major information about myself. But it's like James said, what if something happened? And so actually something did happen to me in college, right? So my friends and I were driving to a party, and it was during my menstrual cycle, and I was just having this horrifying pain. And so I've always had painful periods, but this was just next level. So I was driving, right? And I ended up pulling off to the side of the road, and they're like, what's going on? Are you okay? And I'm like, I need to find somewhere to like use the restroom. Like, I don't feel good. And they're like, what's going on? I was like, it's my cycle. And so my friend, he's also a scientist, and he's like, I think, is there something else, right? A normal menstrual cycle, right? It's not, he's like, I'm a guy, but I feel like I know a little bit about it. And so I ended up pulling over. I started driving again, and I pulled over to a Red Cross facility. And so I was like, can I use your restroom, please? And this horrible pain. And so I ended up disclosing to my friends, right, that I was a carrier for factor 7 deficiency. And even at the time, I did not know I had factor 5 Leiden. So I carried around the thought that I was a carrier, right? And so many of you guys may know, a lot of doctors are like, you guys don't have symptoms. Not at all, right? You're a carrier. But that was not my case. So I was always, I still have this conversation with my mom. I'm like, well, Mom, can I really say that I'm a part of the factor 7 community, right? I'm just a carrier. And she was like, Connor, but you have symptoms, right? You're a symptomatic carrier. And so for me, just disclosing that to my friends at that moment, I kind of had to, right? I was, but I learned from that. They were really close friends. So like I said, if it was a very serious relationship or a close friendships, then I would disclose, because I wouldn't want something to happen like that again. So.
Yeah, that's a really incredible story. And thank you again. I think we talk about this idea of a carrier, but really you have the symptoms. You went through this experience. You had to disclose with friends because, again, as you had mentioned, like, what if something happens, and how do you really deal with that? So thank you again for kind of talking us through kind of a real life example of what that actually means. Okay, Esmeralda, I would love to also ask you again, same kind of question, with this idea of being in a relationship with somebody, how do you handle disclosures?
So for Glanzmann thrombasthenia, we can't hide it. I mean, it's all over our bodies. We bruise extremely easily. So I think like dating, intimacy, like it starts becoming pretty obvious early on. And initially you can kind of say, oh, I just bumped my thigh in a table, or I was being a little careless and I ran into something. But I think when you recurrently see the bruising, you can't hide it. So I start being very honest initially. Like, I have this bleeding disorder, I just bruise extremely easily. I mean, they're just bruises, they go away. I'll get one today, it'll go away in a few weeks, and then I'll get another one. So it didn't really kind of, I shouldn't say it didn't affect me. I think it made me, when I was younger in my 20s, it made me really insecure of my body, not the way it physically looked, but just constantly being bruised. So with intimacy and dating, it wasn't the disclosing that I have the Glanzmann that was difficult. It's the family planning conversation that's difficult. And you don't start having that conversation unless you really kind of know if it's going to be a serious relationship. And I mean, dating was rough. I mean, there were men who didn't want to date me. They said I had bad genes, or they just didn't want to. They were for sure they wanted to be fathers, and they weren't willing to kind of step up to the plate regarding my condition. So kind of the way that I kind of dealt with it, and I look at it now, is that it kind of helped me kind of wean out the men that I feel like didn't share the same values and beliefs that I have. It was just kind of an easy way to just kind of like, okay, we're not a good match. And then I met my now husband, and I didn't know how to have that conversation, like the family planning. Once I knew like that he was the one, and I think I realized he was the one when he like would look at my bruises and he will call them like little nebulas, which are kind of like these like interstellar clouds of matter. And then I looked it up. I was like, you're right. They kind of look like nebulas, like they're brown, like purple, red, blue. And that's how he saw them. He just like, it's a nebula. And I realized like, oh my God, like I love him. Like, what am I going to do? And it was a very hard conversation to have. So I waited 5 months. And when I told him, he's like, I already knew. When I told him the difficulty with pregnancy and planning, and he's like, I already knew. And I was like, how did you know? He's like, you're in your 30s. You don't talk about children. You don't ask me if I want to have children. When you talk about your future, there's no children in there. He's like, I already knew, and that's okay. Oh, like he's a keeper. A keeper. Actually, now he's like mine. I was like, you married 1 in a million. There's just 1 in a million. I told him, that's how lucky you are. But it was a tough journey, dating and relationships, but the ultimate end is like the happiest.
That is wonderful to hear. I think Nicole underscored he's definitely a keeper in our chat space there. So I'm glad, thank you for being so honest about how difficult it can be. I think this is a space where we can be honest and transparent. But I am really glad to see that you got a keeper out of that. So there's a positive ending there. So thank you again for sharing a little bit about, again, this conversation of how you speak about what you're going through with those that you might be entering into a relationship with. So I kind of want to move a little bit back actually to something that Connor brought up very early on in our discussion today, talking about finding a good provider and advocating for yourself. So this idea of self-advocacy. So if we go and move it back to Connor, can you share, any strategies that you would recommend for others, especially when talking with providers about reproductive health issues? and kind of go through, you know, what you've learned, maybe some of the experiences that you've had, and maybe some advice that you think might be helpful for others that are joining us today.
Yeah, absolutely. Like I mentioned, I am a carrier for factor 7 deficiency. So just that one word, right, carrier, just made me so self-conscious, even within the bleeding disorder community, right? I didn't feel like I was part of it. And so it was very hard for me to self-advocate, especially when I started having my menstrual cycles, right? And they were the worst of the worst, right? Missing school a couple of days, bleeding through pants. Like, it was very, very extreme. I have a great, I have a great mother who's very outspoken, and she was always with me with OBGYN visits, right? And so I really learned from her, right? It's very important for you to also become aware of your own disorder, right? Doing your own research. But one thing she said that kind of changed the trajectory of me and OBGYN visits was keeping track of my symptoms. I'm a scientist, so I took pictures, right? I just wanted to make sure I had evidence so I can show my OBGYN, this is what's happening, right? And so I know that my levels say I don't actually have the disorder. This is my life, right? For about a week and a half, 2 weeks every month. And so one of the biggest things, like I said, was just learning about the disorder myself. And I mentioned this a lot, but as a scientist right now, I'm working in a lab finding a treatment for a rare liver disease, but you kind of forget what you're doing, right? You're just in the lab, right? You're doing what you have to do, and you forget that there's patients on the other end of that, right? There are infants with this rare liver disease. So kind of in the same, similarly, I feel like our doctors can get so engrossed in, no, like, this is what my book said about factor 7, or this is what my book said about factor 8 and factor 9. What are you saying, right? And so I feel like it's very, very important to really speak up for yourself. And I understand, right? They have those 2 letters behind their name, but you're the person living this experience. So like I said, I feel like research is the biggest one. And if you are not sure what to do, I feel like it's always great to have someone in your corner like I did.
Yeah, wonderful. And thanks for bringing up, you know, this idea of lived experience. I think that's why, one of the reasons why we're here today within this session is to learn from each other and to learn from what you all have to really share with this community and with others. So we did have James. James had to step out and win an amazing swim meet. So yay, James. Congratulations. Hopefully he'll do well. But I did want to bring it back to Esmeralda, because I know that you've also had some experiences within this area. You know, and I want to ask, you know, how have you handled this idea of self-advocacy with providers? And again, do you have any strategies or advice for those that might be struggling having these conversations, particularly about reproductive issues?
I think, like, with ultra rare bleeding disorders, especially like Glansman's, it's frustrating that other healthcare professionals like OBGYNs are not familiar with our diagnosis. So it just took a lot of research trying to find out a good OBGYN, especially during my mid-20s. I'm not really sure what happened. I mean, I was on birth control from the age of 11, and everything was fine. No severe bleeding, because everything was really nice and regulated. And I don't know exactly what happened, and everything shifted. And for a period of maybe 2 to 3 years, it was constant bleeding. I mean, we were trying different contraceptives, hormonal. I mean, I call them hormonal therapy now for me. I mean, I don't use them as contraceptive. For me, it's like hormonal therapy. Patch, different sort. I mean, I had a box of pills that I was like trying out. I think at one point I even told my hematologist, like, I think I want a hysterectomy. I mean, I can't live life like this. I can't be intimate with my partner because there's constantly like blood everywhere. And there was a very drastic suggestion, so obviously that was like, no. But I kept searching for hematologists, and I went back to the people I trust, my HTC Hemophilia Treatment Center, and I was like, I need a good gynecologist, and they referred me to another one outside the hospital. And she immediately tried the IUD, which worked perfectly for me. The bleeding immediately stopped. But it's constantly like, as children, our biggest advocates are obviously going to be our parents. And they provide us with the tools to kind of send us up into the world. And then we become our greatest advocates. And I know Google's not the doctor, but I think it's nice that we have that resource where we can connect with one another, like other women with bleeding disorders, like who are you seeing, or just researching things. So that's kind of nice that we have that option. And I constantly like have to educate healthcare professionals, and I constantly have to kind of refer, if there's going to be any procedure, you have to clear it with my hematologist. And kind of like what Connor alluded to, like we don't have an MD, but I always say I don't have an MD or a PhD, but I have a GT, a glandular thrombosthenia, and it's like our lived experience. Like we know how much a lot of bleeding is. Like every month, like it may seem a lot for maybe you, Natalia, but for me, I was like, that's my normal flow. Like that's normal. Like, or this is a lot. This is significant. Like 10 straight days of heavy bleeding, it's a lot for me. So we kind of know our bodies, and we kind of know what's a lot for us, what's normal, what's not normal. So being our strongest voice and making sure that our healthcare team kind of really listens to our concerns and kind of really validates that we are a subject matter expert in our lived experience. Like we bring information that's valuable to the team.
Yeah, I love that subject matter expert. I think we use that NHF in a recent State of the Science. And I think that that's a wonderful concept, because you do know you and you have your experiences, and that's a powerful way to advocate for yourself in a space maybe where you're not necessarily being heard as well. So thank you both again for sharing some really good advice for anybody who's here who might be kind of struggling with that. I just did want to highlight very quickly, because we're kind of coming to the end a little bit. We do have time for maybe another question or two, but please, if you're joining us as an attendee, go ahead and put those questions into the chat. We have some time for a question or two. So if there's something here that you've heard from our wonderful panelists that's really triggered, oh yeah, I would love to ask them about this, please definitely share that with us in the chat, and we'll ask it of our panelists as well. So kind of to sort of move us a little bit, I know we've been kind of going self-advocacy and family planning. We did though want to ask both of you, and this is I think a little bit of a harder question, but I think it's important for everybody to hear. Do you have any sort of advice for those entering intimate relationships? So we've talked a little bit about, maybe friends or other relationships, and now we want to kind of go into those intimate spaces. What sort of advice do you have for those who are listening here today for entering an intimate relationship as a member of the ultra rare community? And Connor, I think we'll go ahead and go back with you first.
Yeah. So yeah, it's tricky, right? Our disorders make it a little bit difficult. So for me, I just want to make sure I check with myself. I'm like, are you comfortable? Not even necessarily disclosing, but just talking with your partner about certain things, right? Just getting a little bit deeper, maybe different sexual relationships. This is what I'm comfortable with. Maybe you already know about my disorder. This is what can happen, right? And so I feel like it's very important for you to check in with yourself first. Say, what am I comfortable with? Do I need to maybe do some more research, or do I need to go talk to my OBGYN, right? Or my urologist? Those are really great resources. My OBGYN here in South Carolina is super amazing. Who knew there were certain techniques, right? And so there's just I feel like there's a wealth of information, especially if you find someone who's very aware of your bleeding disorder, who's probably had patients that are in similar positions like you, right? And so it's like, hey, I'm a little bit insecure about this, or going into a relationship and maybe doing this. Do you have any advice? And also not just your hematologist and your OBGYN, but your community, right? And so if you, I feel like my mother and I have a close relationship, so I can say, Mom, like, this is what's going on. This is, the scenario. Do you have any advice for me? But like I said, I feel like the biggest thing is to constantly check with yourself. It's like, am I comfortable? Right? Is this okay with me? And it's like Esmeralda said, if they are not okay with it, then they're not the one, right? They're not the one for you. So.
Yeah, thanks, Connor. Thanks for sharing that idea of if you're not okay with this, then it is not okay. And I think that's something we can all kind of carry forward as we think about being in these intimate relationships with other people. All right, Esmeralda, I'm going to go ahead and turn it over to you and ask you again, do you have any advice for those who might be entering into an intimate relationship? You kind of spoke about this a little bit before, but any other nuggets of information you think that our attendees here could really benefit from?
I think like things get easier as you get older. I think as we mature, those conversations become easier. They were very awkward and very uncomfortable and very insecure conversations to have in my late teens or early 20s. And life will get easier. Women, we become as we mature, we become more secure of ourselves and our bodies and what we need, what we want. And it helps those intimate relationships. It makes things a lot easier when you're older. So I know it's rough periods in life. I mean, childhood and adolescence were really hard for me, then 20s. Finally, in my 30s, I was like, okay, like I was comfortable. I was able to verbalize what I wanted. I was comfortable in my body. I was comfortable in embracing my glandular thrombosthenia. And it was much easier having those conversations. I mean, we're having a candid conversation. So, I mean, intimacy, I mean, it's very physical. So, I mean, I learned that the earlier I disclose it, the better, because I mean, I'm going to bruise throughout my body, right? Like it's going to be rough. It's going to I mean, I'm so delicate with my bruising. So I just realized like the earlier we just have that conversation, we can decide, are we going to go forward with the relationship or not? And if not, okay, there's other men out there. So life does get easier as we get older.
Yeah, and thank you for that. I mean, I'm glad that it gets a little bit easier. That's a good way to kind of end our session, I think, a little bit. But again, this idea of, you have to know who you are in order to be, I think, enter into these spaces with other people. So we did have one question into the chat, and I think this is sort of for you, Esmeralda, but it might be something that we can touch on, I think, in a session a little bit later. But you had mentioned hormonal therapy at one point. And I think this person is thinking about, how has that worked for you in the treatment of prolonged menstrual flow? So if you can maybe talk just a little bit more, and we have maybe a minute or two. I realize we're running up against the clock here, but maybe a minute or so.
So initially, when I first got when I started menstruating, they kind of decided, let's see what happens. And it was nonstop bleeding. They're like, the doctors decided we have to start hormonal therapy, like birth control. They found one, and I think they decide, I'm 11 at this point, so I have really no input on what to say. My mom's making all the decisions. But it helps just kind of control the bleeding, and you pretty much just a light flow of normal bleeding. But the one that worked the best for my body was the IUD, the intrauterine device, because pretty much that stops the bleeding. There's no bleeding at all. Like I don't menstruate. Ideally, I would not like to have this device in my body. I would not like to have hormonal therapy, but I think it's much better than the constant bleeding, because it was days and days, up to 2 weeks of bleeding. So it kind of manages the bleeding. Physiologically, I'm not really sure how that happens, because with the birth control pill, you still have a menstrual cycle bleeding. The IUD, there's nothing. So it definitely was a nice, easy way to just manage the bleeding and kind of not have to worry about it.
Yeah, thank you. Thank you for sharing that with one of our attendees here. And I will note that we are going to have in our third session, we're going to have an actual periods room. So it's going to be a small group. So I really encourage all of you who still have some questions. We're going to have a fantastic OBGYN who you'll hear in our next session, Dr. Charlotta Ayers, and she will be in a small group. So you'll be able to ask whatever questions are on your mind kind of in that period room space in session 3, as well as hearing from her in session 2. So just wanted to highlight that as well for those of you who may have some similar questions. But we are actually out of time. I want to thank Esmeralda. Thank you, Connor, so much for being willing to be open to share your stories, to share your journeys. I think it's been extremely helpful for others who are listening in.